I have to say, I really miss Tampa. I've not been back since December last year. Actually, I
Oh,
came back to the
wow.
UK. I know, I've not been. What happened? I flew back to London, Christmas, New Year's. And then I went to Abu Dhabi. And when I came back, coronavirus. And at that time, you're like, what is coronavirus? But,
I
well,
went to
we've all
India. I
witnessed
got
it.
into opportunity to visit my mom. I went to India for about a month. I spent my Corona days there. I mean, I was quarantined in my home there, but pretty much I had great time with my mother.
Fantastic.
And yes, that was fantastic time during, I think I was there from September to October. And yes, it was
Wow.
fantastic. I really had a great time there.
I think what 2020 taught us is how to value relationships, right? Because when airplanes aren't working and you're not able to fly, you realize how important it is to keep in touch with people.
That is true.
But
People are
also,
not doing now, just social media I was thinking about is not just the social media anymore. Now people wants to go back to their roots. They want to reach out through phones. They want to do video calls, but to
yeah,
an extent that now they want to travel more. Now they want to meet because now they realize how important that relationship was, and they are now. I mean, people are
absolutely.
missing tonight's party. I mean, I'm missing tonight's party. I wanted to party hard. You know me.
I know
We
you,
always at
exactly.
Thai party during this time in Tampa Bay. People come, they have fun, and this time we are missing that. So yes, we this is the time when we are missing. But you know what? It also gave people a reason to think about new things, what innovation
Absolutely.
can help, how we can innovate more, and especially in healthcare. I have been seeing a lot of innovation is taking place. Even the governments are thinking ahead and they are supporting startups in whatever way they can to to make them prepare for future, to
Mhm.
even to give them a support uh, so that they are ready for future, for any kind of. I mean, think about it. So many people died, and what we can do? It's just
You know, the
nature
thing
has
is,
taken its own course.
you raised such a great point, right? Because in those time meetings, which were amazing, and what Thai did is actually give people the opportunity to bring their products, bring their startups, and get an audience. And the thing is, without being able to have events, you can't do that, and it's difficult. But one of my clients here in the United Kingdom, and I work with a lot of
Oh,
startups from
absolutely.
fintech and all sorts of
Yeah.
stuff, but a lot in healthcare. There was one particular one in Oxford. The scientist, he was actually American, and they were developing a mechanism to be able to get this develop vaccines faster, and actually how you distribute it wouldn't be a needle, it will be a patch that goes on the skin, and it penetrates the skin, and it gets the vaccine in. But they couldn't get funding, they couldn't get the next level of funding, so they were quite far ahead. But people weren't thinking, well, what are the chances of the Western world having, an epidemic or pandemic? What are the chance? You have Ebola, you have this sort of stuff. And look what happened in 2020. Should they have been funded last year, they might have been paramount in actually distributing something earlier for COVID. But, retrospect is an interesting thing. The question now, though, is how do we actually help healthcare startups sort of get more face time, but also prevent them from actually falling into that sort of failure in the early stages? What's your view on that?
Falling from failures. People, I see these videos, people always talk about um, how they can become successful. And my motivation is, if I can tell people how I can save you from failures, will automatically make you successful in
Successful.
some way.
Yeah, yeah, absolutely.
And
Absolutely.
that's still a big question. But I tell you, we can talk about two or three things today, which really can help healthcare startups. Um, to think what do they need in order to not to fail, because these are very important. If you see COVID and Corona situation, all of these vaccines, they were primarily betting upon public policy, no matter wherever they are, whichever country, India, UK, France, Russia, China, America, everywhere globally, it's the government, it's the public policy which was helping define the structure of vaccine. You agree?
I agree,
Okay.
100%.
So public policy, I don't know why, but a lot of these healthcares, out of their curiosity and out of their passion to solve a problem, they fall into a trap where they don't recognize how important is public policy. So, if they would have read about any before, there were guys who coming up with some kind of software to fix, let's say telemedicine. Zoom was a perfect example when they started. Telemedicine started like 5 years ago, but nobody adopted it.
Yeah. And now it's
what happened now in COVID? Even an 80-year-old patient is thinking about jumping on a FaceTime call with his physician. So it automatically twisted the arms of some people who were not ready to adopt technology. But why it happened? Not just because they want to jump because of the COVID. Public policy, government, Medicare started paying higher reimbursement for video check-ins or for video telemedicine visits. Earlier, they were paying $30, $35. Doctor doesn't care about it. Nobody cares about it. Thousands of people were trying their hands into telemedicine, and these products were failing because public policy was not supporting it.
I recall we had this conversation 2 years ago where you were saying, you know what?
We talked about it. Let's launch a telemedicine product. Yes.
Yeah. We were like in every airport and stuff like that. We could have this. Yeah, yes. We were talking about that.
And that didn't happen.
No, we should have.
And just because, I said, people are doing it because it's a technology. They love technology. I would love to jump on a video call with you and talk about it. But if I would be a patient and you would be a physician, we won't be doing it if I don't get paid.
Yeah. So it's back to who's going to pay for it, right?
Who's going to pay for it? So that's the second one, So the first thing is the public policy. If they know what's coming in the public policy documents, there's the first step towards finding what's there in the store for innovation. So every healthcare, and especially healthcare startups in healthcare, every country has some kind of public policy about healthcare.
Yeah.
Not just America. America, UK, they have a little bit more advanced systems, but even the countries like India, China, or anywhere, wherever you have healthcare, there is some kind of public policy laws and regulations, which people should look into.
They should look at, but also I think it's the regulators and the government need to be more agile, because some of their policies are, they have rules. Okay, everybody have to have rules, but these rules need to evolve. So the speed at which you could assess these things has to be improved.
Fantastic point. Yes, the speed. So speed is, so the second thing is how you structure your startup around that public policy. And that structure is not just the structure of your company. That structure means the structure of the model of the business.
Yes.
The structure of the business. And speed is a great point, what you said, how, so like Moderna, right? Pfizer, and there are probably 10 other top drug companies who were betting upon bringing the COVID vaccine. But only 2 people, Pfizer and Moderna, were able to do it because of the speed.
Absolutely. What was interesting with Pfizer is that the NHS, the British NHS, was working with Pfizer through the clinical testing from quite early on. Right. So they didn't just, like, ta-da, we've got a vaccine, let's approve it.
No.
They have been in that process throughout. And when you have that sort of collaboration and that agility, that's why they were able to say, you know what, we could roll this out because we know it works. We have been involved in that process. And perhaps startups need to try and understand the public policy, the impact for their business model, and get them involved quite early on as well, so that the speed at which they could launch it's not going to be a hindrance.
This is the fantastic point. The speed, because it should come with the speed of thought. Because if you are not doing it, somebody else will do it. There are a lot of sharp brains around there. And when something comes in a public policy, you have to come up with the innovation by reading public policy, come up with this, and with the speed of thought, you take the implementation part. And that's where the public policy helped, and that's where the structure of business will help. Because then you can find out who would be your investors, who would be your customers, and who is going to pay for it. So if you're looking into the public policy, you would always know who is your customer.
Absolutely.
So just like in drugs case, right? The government, they are buying the drugs. Even the uninsured people, they are getting vaccinated. Nobody cares whether you have an insurance or not. Somebody is paying for it. It's not the customers. It's not the end users. It's the government who is the customer. In
this case, though, the social impact of not doing it is more expensive than actually paying for the vaccine, right? So it makes sense for them to do it.
Absolutely.
Where we at?
Absolutely. So I'll give you an example. I went there for taking my COVID test, right, to an urgent care center. They came up with a new innovative idea of charging me or getting some money out of my pocket, because government here in American system, they have made all the tests for free. Any urgent care center, you can go get your COVID test, it's free. But they came up with a new model. They said, if you want the results in next 2 hours,
you pay for it,
$85. Otherwise, the government public policy says they define whether the results will come in next 48 hours. So you wait for next 48 hours, and if you are not in the emergency situation, like you don't have a temperature, you are not in an emergency room, they have no reason to give you the results in 2 hours. You can wait, which is reasonable.
It is reasonable.
For people who have anxiety and who wants to know about their COVID test because they had some shit going on behind their back. And they were partying last night and they are worried about themselves this morning. What would they do? People like me, they would go, they would pay $5, here it is, right?
Absolutely. So we have two, right? We have public policy and we have who's going to pay for it. So what next?
So no, the second one was structure. Now the third one is the reimbursement, right? Which I'm interested in. So that's what I said here. So because of this public policy and with this law, they created two customers. One is the government paying for it, or your insurance is paying for it. And the second is me out of anxiety.
Right.
So that was smart, But in a normal scenarios, people don't do these things. People don't. I mean, COVID doesn't become a blessing in some sense for, coming up as a trigger to innovate kind of things. COVID has become a trigger to innovate. But think about one thing, I always tell people, Moderna's shares, if you're watching the stock market, the shares of Pfizer and Moderna, they fell down. People who bought it in the beginning, they went into a certain level and they came down and they're coming down. Why? People have never thought about it. So this was like a Fed. It was oversubscribed. People paid too much money. People paid too much attention. So, and that doesn't happen with the small startups, like telemedicine companies, or we tried 2 different programs before Zoom, right? We were on a Vimeo platform. We were on another startup, Streamlabs or something like that. I bought that in $99. Vimeo was like $600 product. They both didn't work, but Zoom is working. It's for free.
And absolutely.
So why do you think they are successful and the other 2 who are charging me money were not successful?
Because it works. Time and time again, it works.
Exactly. And that's what I'm saying. So you have to figure out who is paying for your innovation.
Yeah.
When you're not able to identify your payer, I'm not talking about the customer. Your customer may be a patient. Your customer may be a physician. Your customer may be an ordinary person. But you have to figure out who is actually paying for your innovation, for your product, for your service.
And you know what? That's brilliant, right? Because every company has that same requirement. If There's so many wonderful ideas,
Yes,
brilliant ideas. Emotionally, you think it's fantastic, right?
yes.
But when you ask yourself that question, who's going to pay for it?
That's
That's
where they fail.
actually
They always
number one.
identify their customers. Why would a customer pay? When I'm getting Zoom for free, why would I pay for it?
Exactly.
But people who are buying Zoom stocks, they are paying for us so that we can have a conversation over this for
Absolutely.
free, right?
Absolutely.
So same way, the insurance companies, they are paying physicians to use software. They are paying patients to come into an urgent care center, get the COVID vaccine done or get the COVID test done, but insurance company is paying for it. So we talked about, three things, which is extremely important: public policy, structure, speed, and then the reimbursement. Who is actually paying for your innovation? If you have these three things in your business model, in your healthcare, I can virtually bet there are extremely good amount of chances, more than 50% chances, you would be extremely successful. At least you can help your startup not to fail. Because there's
Right.
another example I can give you. Telemedicine companies, they exist. I mean, there are smaller telemedicine company. There's a very small company called Doxy. You can look at it. It's a
I
very
will.
small company. And now suddenly after COVID, it's like a surge in their user base because it's free. It's easy to use, just like Zoom. And even the best software practice management companies cannot compete with them. And they cannot give them the simpler solution than Doxy.
How
So
do they
every
make
doctor is
money?
using it.
So how do they make money? How do they survive?
Just like Zoom. So they have different packages. The first initial package is for free, but most doctors, they finish their consults in within 5 minutes to 10 minutes. But if a doctor wants
Yeah.
payment solution, they want fintech, they want their patients to pay for it, they have to subscribe it.
And the thing is, the value is, right? Once you have everybody or a lot of people subscribe to it, you are now of a great value for another
Yes,
bigger company to say, you know what? We need that. If we buy
yes.
that and we can pull it in, all of a sudden it sort of completes our circle.
And that's exactly what I'm
Fascinating.
talking about. So I think um, I feel 2021 is going to be a great year because that would be the year the startups which cropped up on which got benefited because of COVID in last 6 months, they all are going to be positive in cash revenue. So they would see some kind of surge, or they will settle down. If there are some bad sheeps, they would go away. But most people, most startups who are working, like I'll give you a few examples, like AI or artificial intelligence, or there are startups who are doing some kind of of course COVID related issues are going to last for next 2 3
And we
years.
see a rise in herbal medicine, right? We
Sorry.
see more natural remedies. We see a rise in natural remedies. So
Yeah.
companies who's bringing a lot of that, you have so many things in India that's now being packaged and sent out because, it's not all about drugs. It's about your well-being, right? What you
Oh,
put
that's
inside.
true. Wellness and wellness, well-being. Now people are going back and now
Absolutely.
thinking of prevention rather than, talking about curing it later on. They're more worried about prevention. So,
I know you send me your dinners all the time and I look at it and think, wow.
yes, yes. So I had the same issue with that startup. So I had to shut down because, I could not figure out who's going to pay for it. But I tell you, I
If you do it
recently,
now, I'm
yeah.
sure.
But now I started using a company called Noom. And if you would have
Yes.
seen, their ads on CNN.
Yeah.
It's a healthcare startup, right? They help you lose weight.
When I saw it though, I thought of your startup and I thought it's exactly the same thing. It's timing, right? A lot of this as
It's
well.
just the time, not
Timing
only
and
the
awareness.
timing, they have huge amount of money sitting there. And they were very resilient in over the years. I've been watching their growth for last 3 years. And now the kind of, if you see Noom app and the kind of content they provide, reminders they send you, they watch your weight loss journey. It's like a personalized attention by somebody who's next to
Yeah.
you. So,
Yeah.
so I think they all could be a features, but primarily it's just that the value, because I'm receiving now, and I see that it's working, I'm ready to pay.
Right, right.
So even if I don't use it, I would still keep that subscription. I mean,
Yeah,
Apple
yeah.
Fitness, I mean, that's a great example. Peloton and Apple Fitness. You know that Peloton share, if you've been watching Peloton shares, it's been like surging very high.
Yeah, but absolutely. They need to reduce the price of that bike though. It's too expensive.
It is very expensive. So think about what I did. I did very smart because,
You bought your bike.
yeah, I bought the normal $500 bike and I took
I
a
get
$10 subscription Apple Fitness. And when I bike in front of my TV all the time.
love
So
it.
I don't need a
Fantastic.
Peloton.
Exactly.
I'm sitting on my bike and I have my TV right in front of you. I have a $10 Apple Fitness subscription a month. And that has all those fitness tricks and fitness classes and group sessions, everything I was getting through Peloton.
Brilliant.
So, yeah, I mean, that's where you see the competition, and that's where you see how companies are coming up with an optional, startups. I call this optional startups.
But I mean, you're not, you're very experienced in startups, in launching companies, and some have failed. Most of them have been, you're very successful.
Yeah.
You're an angel investor. So, I mean, you need to write all this down though.
Well, that's what we're doing. These videos are basically, we are building these videos so that we can share our wisdom. We can talk to other people. And we are, I mean, I'm always open talking to people. And that's where, we are having this video. We'll have probably more videos like this.
We need to do some live as well.
Yeah.
Get people into it.
Yes, we need to do this. Well, let's jump on a live session next time. But this is great conversation. And I wish everybody a happy new year, and I think it would be a great year for us. If you happen to visit Tampa again, let's connect.
I will do. As soon as I'm able to fly, I will be down in Tampa. I miss it. My place is.
You have UK passport though, right? You're not able to fly right now. UK residents, they are being tested.
I can't come right now. However, if I fly to like Barbados, which I don't mind, and I spend 40, I cool off.
Then.
Exactly, I cool off in the Caribbean Sea and then fly to Tampa. I could do that.
Yes,
that's all right.
Yes.
So yeah, I mean, there's a cooling off period of 14 days somewhere neutral before I come to the US. But yeah, I mean, like I'm looking forward to coming back. Of course, here in Britain we have the new variant. More countries are starting to see it. It's really been terrible. But British government, they have set up test centers throughout Britain now. And I went for a test and I got my results back in 1 hour. They just texted to me. And it's amazing. But this is what is so critical as well, is that governments, they need to be part. Public policy need to evolve. They need to be able to move fast, not actually have bills and parliament and cabinet and everybody sort of arguing about it. They need to be able to move so much faster.
That is true, actually. If they are able to pass on the reasons for innovation or triggers of innovation to startup entrepreneurs, I think they would be a great help to the entire startup ecosystem. Right now, what startups has to do, they have to figure out, and they have to spend time, and that takes a lot of time to figure out and go through the public policy documents, read 1,000-page reports, and then figure out what to do next. I tell you this, just yesterday, this bill is passed. It's sitting on my table, and it says legislative impact of year 2021, combined impact without this code Z221 for additional 3.75% revenue increase in medical practices for year 2021. A week before they released Medicare fee schedule, a week before, and that gave a 10% reduction. Now think, 1 week, 2 changes, 10% reduction to 3.75% increase. And some of the specialties, the increase is 13%, 11%,
oh my
9%.
God.
So volatility, it's so volatile and so many moving parts. It's just very difficult.
How do you keep up?
I'm still trying to figure out what they want to say, how my physicians would be able to make 4% additional revenue. But that's what needed, and that's what I'm saying. Public policy is very important. So as an entrepreneur, as a startup entrepreneur, here we'll summarize it. I would go, whatever is my passion, I would go back and see what the public policy documents are available to me, because they trigger innovation. We have to find the triggers of those innovation right then and there. And then structure the business model, find out who is my reimbursement model, who's paying for my innovation, and that's it.
Perfect.
3 things.
With those 3 things, you have a successful startup.
Absolutely.
So here's what I'm thinking, right? Live here, sort of live.
Yeah.
We will do a startup.
Yes.
To help this.
Yes.
And what we will do, we will actually start collecting information for public practice and public policy changes and stuff like that. And for startups out there, contact us. We'll have the information.
Well, it's a role of incubators. So, all those university incubators, research incubators, even the Medicare has an incubation, kind of. This is what they should be doing it, ideally. I mean, that's they have tons of funding for that. They have funding for research purposes, but their research should be in those areas where they can find those
Maybe
triggers.
We just aggregate it. They populate the information and we just have it there.
Yes.
So we could be the encyclopedia.
Fantastic.
So happy New Year's Eve, and 2021 is tomorrow.
Yes.
And I think we should do this again next week. And
Absolutely. We'll do a live session next week.
Okay. Thank you so much, Kunal.
Thank you. Thank you so much. It's so nice to talking to you after a long time, Vidya. Nice to see you.
Absolutely. Same here. Bye-bye.